thank you very much, everybody, for being here today, for inviting us and setting up this wonderful event, which is very, very meaningful for everyone. It's being in Pakistan, obviously, my alma mater is in Islamabad, in Rawalpindi Medical College. That's where I graduated. I was born in the UK, and I spent a lot of years there. And one of the things that our family did was migrate back to Pakistan. So I spent almost about 13 years in Pakistan and then went back to the UK. So I did a bit of a boomerang, if you like. But when I went back to Pakistan, to UK, I started to have a bit of an identity crisis. And I started to ask myself, where do I belong? I was grown up thinking in English, and now I'm thinking in Urdu. Although my Urdu wasn't very fluent, but I was able to. And then my brother, my elder brother, he's an aeronautical engineer, and he said to me, "Shah, listen, you're a champion of both cultures. Embrace that." And I actually thought about that, and I actually held on to that, which brought me, at the same time, I started to develop an interest in behavioral sciences, in mental health, and subsequently an interest in culture and mental health, which is so important. So, which subsequently I developed some papers and published some papers and worked as the chair for the Transcultural Special Interest Group, Royal College of Psychiatrists, who will be joining us shortly online as well. So, one of the areas हम लोग जो बात की है, Professor Preeti ने बात की, बाकी हम sure आप लोग भी सारे distinguished guests, our senators, our senior professionals here, and also our guests from British Asian Trust and Sehat Kahani and British Council, etc. See, I'm sure everything, there's one overlap, हर चीज़ में, in the mental health, and that is culture and understanding of culture. I'm going to tell you a little bit of a background very briefly. I worked in the Republic of Ireland for a little while. वहाँ पे एक junior doctor, I won't say where they were from, so they were on call overnight, and they admitted a patient because the junior doctor, who had never worked and only been working for about 2 weeks in psychiatry, admitted the patient because they thought that the patient was deluded. And when the consultant asked the junior doctor, "Tell me the presentation," he said, "The patient believes that she has butterflies in her stomach." Now, as we know, butterflies in the stomach in English means feeling anxious. Now, this is someone, it wasn't her fault. Now, it's called concrete thinking, abstractly dismiss nikal, and you think very concretely. It's something which, if we don't understand the person, the individual, then we've lost, and we're not doing our job properly. So the overall understanding, Pakistan culture में हम लोग UK में रहते हैं, वहाँ पे भी culture very similar. वहाँ पे भी जिन्नों के बारे में बातें होती हैं, जादू के बारे में बात होती है, black magic के बारे में बात होती है. So it's not any different, and we need to understand that. And we can't ignore it because it's part of the culture, part of the religious belief. And one of the things that we need to do as psychiatrists, as professionals, as experienced professionals, is not dismiss patients' beliefs, because if we do that, we've lost them. And if we lose them, that therapeutic relationship and that understanding that we have between us, and that's our responsibility, is how we link up with them and we make the difference. It's fantastic seeing the work being done here with, between different organizations. I'm proud to say that the Royal College of Psychiatrists, for which myself, Amir and Yasir, we are fellows and we've done a lot of work, are very, very, very much interested and very engaging in all three cities. Today, tomorrow in Lahore, and the day after in Islamabad. Today we'll have the President for International Advisory Committee, you'll see him shortly. And then we'll have the President, Adrian James, tomorrow, and Trudy Sire Nagara on the 8th. So they'll be joining us, and they're very interested in the work. But the most important people are yourselves, who are doing the groundwork, who are interacting, जो यहाँ पे काम कर रहे हैं, हम तो बाहर से आ जाते हैं, बड़ा आसान है, लेकिन we want to understand, and because obviously we have our links and our bond with Pakistan, we are always here, and that's why we have set this up as a mental health awareness. 10th को आपको पता है is Mental Health Awareness Day. This is our day, being mental health professionals, and it's our day because it's our responsibility that the work that we do is to help. That's our bread and butter, is to help individuals. And that's what it is. And I think that's the foremost. Our mischief was so okay, we are there to serve people. And that's the only thing, serve, nothing else. And we are very lucky to be the creme de la creme in the academia. And we've educated ourselves to be at a level where we can serve people who suffer. And if we are able to do that, if we are able to serve the people and make it a better society, I think we've done half of our job. And that's all we can do. We can help individuals. The most important thing, I suppose, and a lot of you who are involved, is empowerment. Empowerment for individuals, for communities is so important. Give people back the control. There's a lot of talk nowadays that we have about diversity, equality, inclusion. But what does that actually mean? I mean, is it a tick box exercise? What it is? I mean, somebody once said to me that, equality means giving everyone everything. Is that right? Is it? My understanding would be that equality is giving people the tools to take back control and having the tools to succeed. Now, for our patients, for the community, their tools are regaining back and empowering them. And I know a lot of organizations who go in, indulge and go and work within communities where it's very difficult for them to access care is something that I know is already, these projects are taking place, but that's where we make the difference. Because as they say, individuals, communities, villages, towns, cities, once we empower them, once individuals understand their own mental health and their difficulties, it makes people more powerful. When you make people more powerful, their self-esteem, their confidence, etc., you grow as a nation, as citizens, as a community. And that's what we see in the UK and in the West. We see a lot of that work, and that's why it's important that we focus in these areas. I think the other thing I want to say, the last thing, I don't want to take too much time because there's a lot of people who we want to hear from, is while we do empower people and attempt to give them the understanding of what mental health means, we must also inform them that mental health doesn't necessarily mean mental illness. It doesn't necessarily mean mental disorder. Although it's important that for early interventions that we do understand and we do give people the education. But also we must differentiate it from mental reactions or to adverse life events. And we all experience them. If I wake up on the wrong side of the bed and I'm having a bad day, that's not mental illness. And we must tell people that. It's okay not to be okay, as they say. Adversity in everybody's life, we will experience that. And we must inform people that it's important that we do differentiate between what is mental illness and what is not mental illness. Having said that, people will feel unwell mentally. We all will. I will. There's days going to be where I will feel depressed, where I will feel anxious, where I will feel despondent. And we must inform people that, these are not necessarily mental health tools. But then on the other hand, we must also encourage them, educate them as to what are the early warning signs, starting right from the beginning. Preventative measures, understanding, so important. I couldn't stress more on that. So I'm going to leave it at that, and I just want to thank you all for all the good work that you're doing. Everyone in this room, I mean, they've been called for a purpose, only and only because you guys are doing wonderful work. And what I would really like to say is that let's work in synergy. It's important that we put things together. We are very much keen to work with all of you as the British Parkinson's and Psychiatric Association. We've got a lot to learn from all of you. We're working on ground level all over Pakistan. So it's humbling to be here. And I want to thank you all very much for coming today. And let's make Mental Health Awareness Day meaningful. Shukriya.
Non-medical people. And I know there are some who don't speak Urdu, so I'll continue to talk in English. And I'll try to make the message very simple, so you don't all fall asleep. Whenever I tell people that I'm a consultant psychiatrist in addiction, they always look at me and smile. So I have to figure out whether they're smiling because I work in addiction or they're smiling because they need help. So if you need help, come smiling to me, I'll come and talk to you. And the other great thing about seminars are, people come to seminars to catch up on their sleep. And I know sometimes it can be boring, but over here we're on a road show to increase mental health awareness. So my message will be very simple, 5 minutes Just be awake for that, and hopefully you'll be able to go back to your sleep after that. We're here to talk about mental health. I also add addiction to it, because addiction in itself is kind of a subspecialty. Some people call it addiction medicine, some people make it part of psychiatry as well. But they all interlink together quite a bit. In the UK, they say 1 in 4 individuals would suffer with a mental health problem. That's about 25% of the population. I'm pretty sure because of the difficulties and complexities that you face in the society here, I'm pretty sure the numbers will be higher. But if you just look at Karachi with a population of about 40 million, and these are conservative estimates, 40 million, if 25% of that population is experiencing mental health problem, that would make it 10 million people experiencing mental health problems. That's a staggering number. The other important issue is that you might, all of those 10 million people might not always need to see a psychiatrist. Yeah? You come to a psychiatrist right at the point where you feel things are becoming unmanageable. Before that, a lot of things are in your control. Like to live a healthy life, you have to have a healthy lifestyle. Eat healthy, exercise, do good things. To have a healthy mindset, you have to approach things in a very healthy manner. You have to approach things in a manner which makes it more manageable. You break it down into small, manageable tasks. Life is complicated, life is difficult. Life is very difficult if you look at the long picture and what you plan to do. But if you break it down into little chunks, and you achieve those little chunks one by one, then they become more manageable chunks. When you start experiencing mental health difficulties, particularly if it persists regularly, consistently, for long periods of time, 2 weeks and above, and it's affecting your function. In every psychiatric definition, mental health diagnosis, you always see the concept of global functioning. When it starts affecting your function, it affects the way you eat, it affects the way you talk, it affects the way you work. That is when you should start seeking help professionally. One of the most important elements of what we tell people is psychiatrists are doctors, not magicians. They do not have a magical cure. Things have been building up for years and months and years, and then you come to a psychiatrist expecting things to be resolved within one session. And that's highly unlikely. It's also very important to remember, you can't completely eradicate or completely sometimes cure mental health problem with a tablet. You have to psychologically change your mindset. You have to change your social setup. You have to understand the social difficulties and the social triggers you have. You have to also change your lifestyle. If you don't do these, then might as well not try and take the pharmacological interventions. Pharmacological interventions scientifically work better when all these things are done together. So very briefly again, and I'll leave you guys in peace after that. I'll talk about drug addiction and alcohol addiction. It's associated with the main issue that we're kind of here to raise, stigma. People don't like talking about mental health. When they go to a psychiatrist, वो generally बोलते हैं ये तो पागल हो गए, पागलों के डॉक्टर के पास जाते हैं. That means you're going to a doctor for crazy people. And this stigma exists everywhere. It's not unique to Pakistan. It exists in the UK. I mean, we've went into societies, deprived societies over there, where we found it difficult to engage with them because they didn't want to see a psychiatrist. We've seen individuals who became psychotic and remained psychotic for years before they actually sought help, or they became quite aggressive before they sought help because they didn't want to go to a psychiatrist. So the stigma needs to be addressed. Sometimes you do need help. Sometimes life can be difficult. It's alright to seek help, and that is our main message. It's alright to seek help. You need good mental health institutes in this country. You need to work and collaborate with the rest of the world. We're British Pakistani psychiatrists based in the UK through BPPA. We're more than happy to engage with any forum here to kind of enhance the services, create better standards, increase and improve the outcomes that you get. But drug addiction and alcohol addiction is also a pertinent issue throughout the society. I know culturally and religiously it's frowned upon, and that has led to people not reporting their problems. I moved from the UK for about 2-3 years to work in the UAE and Dubai. And we saw quite a bit of addictions there as well, but the fundamental issues were the same. People would seek help so late in their journey that recovery from there became even more complicated. And I know you must have seen some unusual cases in the media more recently, which was linked to people using drugs or crystal meth and becoming quite aggressive and violent. So if these things are not addressed earlier on, they can lead to very dramatic and drastic outcomes. So take home message, apart from your lovely sleep today, the take home message is you have to make sure you look after yourself, your well-being, your overall well-being. It's all right if someone is struggling. If a child comes up to you and says, my heart is racing, my arms are calming, and the child is anxious, it's all right to validate that emotion. It's all right to kind of understand that they might be experiencing problems. It's all right to seek help. And it's also important to support people who are suffering from mental health problems. That's something we all lack. And again, I would love to emphasize how important it is to make sure we I'm pretty sure there are great institutes in this country delivering mental health problems, but we would like them to become the best in the world, and we're happy to again engage with them from our platform in the UK. Right, thank you very much for your time.
Like all of us, we are trying to be as brief and stick to time, so I won't take more than 5 minutes. And thanks for kind introduction as well. Fine, so I graduated from Royal Medical College and moved to UK back in 2002. So been consultant for 11-12 years. I think what I'm looking at is some of the issues we already talked about, is stigma and looking at a patient as a whole. Our mental awareness, all the aim is to be able to see that the patient, when they're going through a psychiatric issue, is not one entity, it's a full family, it's a social setup that gets disturbed by somebody being unwell. So our assessment model back in the UK is that we actually look into what's the physical health contributed to that, what's the social setup like, and as Professor Afridi said, what is actually going on in the family setup. So all of those things, they make together all the jigsaws of the puzzle to resolve the mental health issues. I work for NHS. I have got special interest in medical education. As an introduction said, I've got my organization approved as GMC's Muslim body. So we can actually recruit doctors from overseas without them actually going through the lab examinations or Royal College examination or through any other training initiatives. So they can actually directly come and work for us. It's a 2-year program. It's their homes. And that actually brings a lot of biological model into treatment. So there is definitely a role of biological model, medications, depot medications to manage some of the very complex conditions like schizophrenia, bipolar, or schizoaffective disorders. Because these people we are assertively treating, we've got no right to actually get into somebody's privacy or get into their front door without their consent. So there's a very smart legislative process called Mental Health Act, and we have to comply with that. I'm a policy author for Mental Health Act, and we do feel that the onus of responsibility shifts to ourselves when we are treating people who do not want to be treated or lack understanding and insight into their disorders. Another thing which I do feel is a consent and confidentiality. I'm also the Caldecott guardian for the NHS, which means I am the one who gets reported to if there's any breaches of confidential information elsewhere. So that's again talking to some of the parents and children yesterday. I think one of the stigma alongside having a mental health issue is what happens to my information, who will get to know about that. So these are the things that we have worked on and we need to work on in this country as well, that people should have the trust to go to a psychiatrist and be able to express themselves why they are struggling with. And finally, for myself, we have done MOU with the other countries as well, where we've been able to do a trainees exchange program. We've been able to train nurses, doctors, social workers, allied health professionals, and that is part of the remit that I will be actually looking at my next visit to Pakistan to see if there are any of those avenues that we can explore. We also offer research opportunities. We join CPDs, CMEs. Obviously, world after pandemic is a lot more smarter now, so a lot of things can be done remotely. So these are the things that definitely we'll be focusing on. Working with British Pakistani Psychiatric Association as treasurer, our website has got all our contact details. I'll be very pleased if anybody contacts us to develop on any of these areas that I've mentioned. And thanks very much again for this opportunity.